Hi, this is our quality improvement team. I'm Sarah.
I'm Tara. My name is Maureen.
And I'm Tammy. And we interviewed Jamie Robinson. She's an MSN RN CEN at Western Missouri Medical Center. She works with the quality team in a collaborative effort with the executive leaders, frontline staff, and others to make sure that processes are in place, to make sure that safe processes are there for patient safety and education. Ultimately, the CEO of the hospital is held accountable for the quality management process, but the CNO, the Chief Nursing Officer, and the COO is responsible for ensuring that the quality management practices are in place for everyone at the hospital. And Western Missouri is based in Warrensburg, Missouri. It's kind of a small town. It has 60,000 people in the primary service area, and it is a non-for-profit organization. Something very unique about this hospital and this organization is the diversity of the patients and surrounding community members that they have. They have a college there that has students from over 30 different countries who English may not be their first language, and they may not be used to medical care as given in the United States. They also have Whiteman Air Force Base, which has a younger crowd, and they also service not only the Whiteman Air Force Base, but their families as well. And stakeholders include all the patients of the community members themselves, even if they do not visit the medical center, employees, board of trustees, and that's it.
Tara, you're muted, I think.
I'm muted, sorry. How WMMC identifies their quality metrics is through several different ways. So their main and probably most important is through the Centers for Medicare and Medicaid Services. So they can utilize the metric data that's presented on there, but also they make sure that they report their own data for their Medicare and Medicaid patients back to CMS. So that's an ongoing relationship. And then Joint Commission, which is an agency that comes and surveys the hospital every 3 years. And so this is a really important talking point just because being surveyed is required in order to be reimbursed by Medicare, which is obviously very important for a hospital such as WMC because they are a nonprofit. So Medicare and Medicaid patients, that reimbursement makes up millions and millions of dollars for the hospital for their income. So this is very important to make sure that they're making money and servicing their patients. And then another place that they can get quality metrics and understand other hospitals' information is through the Hospital Industry Data Institute, which gets information about all the hospitals in Missouri, and it's specific to patient outcomes. So this is about just the responsibility of the quality management, and Tammy introduced it well, but it's a really collaborative effort. There's a lot of people involved when it comes to improvement strategies. Jamie told us that the quality team will meet once a month. So the quality team, her and a few other members will sit down with the executive team and they go over their reports, they strategize, and check in. A lot of it mainly too is improvement plans that are already in place and what's the progress that's being made on that. So here I just incorporated a picture. This is my mom, the CEO, and the CFO, the Chief Financial Officer, and they were at a breast cancer awareness event. So that's just a cute picture of them. But something that's also important to mention about the meetings is once they leave the meetings and the team and the plans are in place, it's very important that the quality team also meet with physicians, frontline leaders, people who the data actually relates back to make sure that the entire staff is understanding the quality measures that the exec team's trying to make. And so this just makes sure that the whole hospital is aware of the improvement plans and what they're doing well and what's not so well. So it's not just the exec team that carries that out, but it's also the frontline leaders and the people actually on the floor. So this is WMC's board of directors. And so they also play a big role in overseeing quality. So they meet quarterly with either the CNO or the quality director will present data to them, and they also review the performance annually. Something that we found really interesting and important to note was WMC is a nonprofit organization, but they're county owned, which actually makes them a government facility. So their board members are actually elected. They are not just appointed. And so that is a really interesting talking point because being elected and not appointed, the board members can come in with more of an agenda. Not necessarily negative, but they do have more of an agenda, and it's a role that they want to be a part of. And so usually they care a lot about the community health and what the hospital is representing in the community. So that was just an interesting thing to do with their board of directors.
And then WMC pursues the triple aim in many ways. And so we found this article just talking about obstetrics, or the OB portion of the hospital. And so really what WMC is aimed towards is promoting better population health specifically for women. And it's something that they're very proud of as a hospital, and just helping the women in Warrensburg. They advertise on many billboards, and they've also tried to build brand new clinics for women and just to help the population in Warrensburg. And so, like Tammy mentioned earlier, the area is very diverse, and so that they have the college there, UCM, and then they also have the Whiteman Air Force Base. And so they're really serving a unique population of women, both young women at the college, and then as well as wives of men in the Air Force, or women in the Air Force as well. So they've invested in an outpatient community worker to assist with resources, as well as an OB navigator. And just the collaborating leadership from the clinic to the unit is very important. It's something that they really pride themselves on, is having collaborative leadership amongst the members in order to really implement these quality measures. And then this is also more about the quality improvement. So WMMC focuses on working with all members of the healthcare team to improve the quality, and so it's really a collaborative effort, and they really make sure that everyone's on the same page. And so, kind of like Tara was mentioning, you'll have people who have a vision for these quality measures, but it's really the nurses and the physicians and the people who are kind of on the front lines who are really implementing these measures. So it's really important for everyone to be on the same page, and just to see how individually that they can help out and carry out these quality measures. They have an OB navigator that assists expectant mothers, and so this is a really important strategy that they've implemented to help women and to really measure quality. These OB navigators help the mothers with diapers. They help them just with breastfeeding, really anything that they need. And also something as well as if they have a mother has a personal OB, but at the time that she delivers, that OB isn't working, these OB navigators will help assist the mother in finding someone to help deliver their baby. And then another thing that WMC focuses on is really what the pregnancy looks like throughout the duration, and what it looks like after as well. So just making sure that the mental health of the mother is good, and just checking in with them and any concerns that they have. And they also have an outpatient community worker, which kind of functions as a social worker, just assisting the patient with any resources in terms of transportation, food, housing insecurities, insurance, things like that, just to make the process smoother, and just to have someone who's there with them every step of the way.
I just wanted to add, it's improving patient experience. That was the quality that they were specifically improving with the OB navigators, the social workers. It was all about improving patient experience, which is a quality measure that sometimes is hard to gauge and get the metric for. And so that was really specifically what they were focusing on improving through those strategies.
And so we asked Jamie specifically what were some successes that they had in quality management. And she specifically mentioned that they had a great success was that they had 0 hospital-acquired infections during hospital stay for their last reporting period. And this is a great statistic since hospital-acquired infections are such a large issue for hospitals and nursing homes. And it's impressive because safety protocols like hand washing techniques have to be maintained and have to be used by all employees consistently in order to uphold this statistic. And then additionally, she mentioned that she's proud of how they monitor safety equipment in the hospital. And so they are proactive in making sure that all the equipment is up to date and they replace any equipment that is due for maintenance or anything like that. But there are certain compliances and they are doing very well at upholding that as well. And then she said they're very proud of their overall improved patient experience during her career at WMMC through all the improvements we've mentioned, like the social worker and stuff like that. So we especially found it interesting that during Dorinda's, Tara's mom time as CEO, they were at one point ranked 5 stars for patient experience, and this rating actually went down. And so they had to kind of refocus into that patient experience and make changes to then bring it back up. And so they were proud that they were able to bring it back up and through the improvements. And so we also asked her, like, what's the biggest challenge to upholding the quality management? And as with most companies, one of the biggest challenges is upholding employee turnover. And so when there is a high employee turnover rate, that means people are constantly like coming in and out of the hospital. And with that constant fluctuation, things can kind of get lost in translation. So to challenge or to combat this challenge, consistent training is crucial so that every new employee knows, exactly what the standards are for certain practices, but having specific training that's exactly the same for every employee is difficult, and that can result in variance in knowledge throughout the company. And so we asked her kind of about, what is available to the public. And Tara mentioned previously that there is data relating to quality available through the CMS and Joint Commission. So all of this data can be viewed online by the public. And we also noted actually that some of the positive data is displayed throughout the hospital, on posters, on billboards, stuff like that. And on those posters, they include a way to assess all the other data and access it. And so that's one way that patients can see it right away when they're in the hospital. And then Jamie noted that there are specific quality metrics that they report to all parties, such as the board, stakeholders, patients, etc., monthly. And they can do this, through board meetings, through management meetings, and even through email to patients. And then lastly, data to assess quality management is pulled from the diagnosis-related group coding from patients' charts. And obviously, the public can't go into a patient's chart and figure out, how long that patient stayed or if they acquired an infection. But the information from the charts is pulled and then sent to the CMS. And then from that information, the CMS creates those ratings and for patient outcomes. And then those are the ratings that are available to the public.